CBS 11 News.
Welcome, everyone, to this CBS 11 News special report, which we are also live streaming for you right now on CBS and DFW. We are coming to you live right now as Texas Governor Greg Abbott continues to update us now on his latest phase 2 of the reopening process of the state of Texas. Let's listen in to what the governor has to say.
And protect people from getting COVID-19. Until that day comes, our focus is to keep you safe while also restoring your ability to get back to work, to open your businesses, to pay your bills, to put food on your tables. But let's be clear, COVID-19 still exists in Texas. Our goal is to find ways to coexist with COVID-19 as safely as possible. That includes continuing these safe practices that you've already adopted, maintaining safe distances, wearing a mask, sanitizing your hands. It is a fact that these safe practices, they save lives. Another safe practice that must be emphasized is protecting our most vulnerable Texans, those who are 65 and older who may have other types of health conditions. They represent most of the COVID-19 deaths in Texas. As we move into phase 2, the safest strategy for seniors is to continue to stay at home if at all possible. Additionally, in the 3 weeks since I announced phase 1 that Texas was opening up for business, we've also substantially boosted our capabilities to respond to and to contain COVID-19. For example, we now have ample supplies of PPE. Get this, we distribute well more than 1 million face masks per day. Our testing has also increased. I told you all 3 weeks ago that testing would increase as Texans opened up for business. And that's exactly what has happened. In just the first half of May, we more than doubled the number of tests that were given in all of March and April combined. We are now averaging more than 25,000 tests per day. And we now have more than 600 testing sites all across Texas. But most importantly, to our ability to open up was strengthened by the ability to identify and to respond to COVID-19 hotspots. We have found that most of the areas that have sudden increases in COVID-19 positive cases fall into 3 categories: nursing homes, jails, and meatpacking plants. When hotspots like this arise, we send in surge response teams to quickly provide COVID-19 tests and to separate the sick from the healthy and to ensure that the outbreak is contained. We also help to sanitize the area to protect people from getting infected in the future. An example of this is our program to test 100% of all of the residents and staff at all nursing homes in Texas. Another example is our effort to test thousands of workers at meatpacking plants as well as residents in the Amarillo area. Now, when we increase testing in hotspots, the number of people testing positive is going to spike. Then what we find is that usually within a week or 2, the flare-up is contained. The number of people testing positive is reduced, as is the number of people who are hospitalized. Now, these surge teams, they are led by the Texas Division of Emergency Management. They work with the help of the Texas Department of State Health Services, the Health and Human Services Commission, the Texas Emergency Medical Task Force, and the National Guard. Already, these teams have tested more than 35,000 Texans across the state. We also want to thank the thousands of local firefighters who are supporting the effort to test at nursing homes across Texas. Another strategy to contain COVID-19 is already in place. It is the voluntary test and trace system that contains the spread of COVID-19. Systems like this have been used in Texas for decades now. And I will ensure that this system protects your privacy and your personal liberty. Now, as we have advanced toward phase 2 of opening business in Texas, we have focused on several key metrics. One is the positivity rate. That is the percentage of the people tested who test positive for COVID-19. To state the obvious, as testing increases, so will the raw number of people testing positive. What matters the most is the percentage of the people who test positive. The White House Coronavirus Task Force uses this standard as the criteria for opening up. It requires, and I quote, a downward trajectory of positive tests as a percent of total tests within a 14-day period, and that is exactly what we have seen in Texas. The past month has shown a downward trajectory in the positivity rate. For example, on April the 13th, the 7-day rolling average was about 13.8%. Since then, that rate has steadily declined to now about 5%. Another key metric is hospitalizations and hospital capacity. We want to avoid situations like what people saw in New York, where hospitals were overrun and they lacked desperately needed capacity. Because Texans have helped to contain the spread, we have plenty of ventilators and hospital and ICU beds. In fact, get this, as of yesterday, we had fewer people hospitalized for COVID-19 than any day since April the 21st. If our hospital capacity ever gets compromised, we will take swift corrective action to ensure that we will be able to take care of our fellow Texans. That brings me to today's announcement for phase 2. Informed by the data that I just outlined, and with surge response testing strategies in place, Texas is prepared to move into phase 2 for further opening up for business. Very importantly, every decision I have made, as well as every decision that I will announce today, is unanimously supported by our team of medical experts. From day one, our mission has been to use data and doctors to open Texas in a safe and responsible way that contains the spread of COVID-19. That commitment to data, to doctors, it underpins today's announcement. Those doctors have provided safe standards for businesses, for employees, as well as for customers. And those standards are contained in this book, and they apply to all business operations that open up in Texas during the course of this pandemic. Well, based on the advice of the best medical doctors, as well as a team of outstanding business leaders, I am proud to announce that businesses that can open up today. As you know, barbershops and hair salons, as well as gyms, are already open. Effective today, other personal service businesses will also be able to open. A list of these businesses, as well as their safety guidelines, can be found at gov.texas.gov/OpenTexas. Additionally, beginning today, businesses located in office buildings, they are able to open. They can open to the greater of 10 employees or 25% of the workforce, provided that the employees maintain safe social distancing. Now listen, one thing that we all know, an important part of reopening is access to child care. So, starting immediately, child care services are able to open. That also includes programs like Boys and Girls Clubs as well as YMCA programs. Then, beginning this Friday, May the 22nd, a long list of businesses can now reopen or expand capacity. Restaurants can open to a 50% capacity. Bars, wine tasting rooms, craft breweries, and similar businesses can open at a 25% capacity. Like with restaurants, those capacity limits do not apply to outdoor areas that maintain safe distancing. In addition to that, a wide range of businesses, ranging from drive-in concerts to bowling alleys, can open up at a 25% capacity. A list of these businesses can be found at the Open Texas website. And then on May the 31st, youth sports camps and programs like Little League will also be able to open. I want you to know that parents will be allowed to spectate so long as social distancing is followed. Also on May 31st, other youth camps can open, including all summer camps and other daytime and overnight camps. This includes programs like scouting, vacation Bible school camps, and 4-H camps. Also, some professional sports can return on May the 31st. That includes pro golf, auto racing, baseball, softball, tennis, football, and basketball. For all sporting and camp activities, special safety standards apply to prevent the spread of COVID-19. These can be found at the Open Texas website. Next is summer school. School districts have the option to provide summer school so long as they follow safe distancing practices as well as all other health protocols. These classes can begin as soon as June the 1st. Now, let me give you this perspective. As we open up, we must continue to place health and safety first and foremost. There may be times when a county or a region is facing COVID-19 challenges that prevent it from opening at the same pace as other parts of the state. Now is one of those times. As many people know, the area around Amarillo is suffering the fastest growth of COVID-19 in Texas. Now, this problem is largely the result of meatpacking plants in the area. That COVID-19 spread, as well as the challenges that it poses to the region, is something that impacts the regional healthcare system, and it requires a temporary pause in the opening process. The same is true for El Paso, where the hospital capacity is too close for comfort at this particular time. Now, we have surge response teams that are actively working to increase testing and to maintain hospital capacity in these regions to ensure these regions can safely move into phase 2. Their beginning date for phase 2 is being pushed back just 1 week. Everything in today's order that is slated to open later this week will also open in those regions 1 week from this Friday, on May the 29th. These will give those communities and our surge team response the time needed to slow the spread and maintain hospital capacity. It will ensure those communities safely move into phase 2. The counties that are part of this delay are El Paso, Randall, Potter, Moore, and Deaf Smith. Texans have always faced adversity, and Texans have always prevailed. By using safe practices, we are slowing the spread. By protecting our most vulnerable, our fatality rate is one of the lowest in America. With the help of our hospitals, our recovery rate is one of the best in the country. We are getting through this. But now more than ever, we need to work together as one Texas. So as we move into phase 2, be a good neighbor. Be a Texan. With that, I'm going to pass it off to Dr. Hallerstadt.
Thank you, Governor Abbott.
Okay, we have been listening to Texas Governor Greg Abbott right now giving his remarks as the state moves into phase 2 of reopening per his orders and per his recommendations. Phase 2, by the way, we're talking about child care centers, massage parlors, and youth clubs effectively open today with some restrictions. We also heard the governor talk about the next phase that would reopen. That is scheduled for May 31st. At that point, he's talking about reopening youth camps, Little League, summer camps, to include daytime and overnight camps, and some professional sports along with restrictions as well. That is scheduled for May 31st.